Hello, I'm Aaysha Cader. I'm an interventional cardiologist based in Dhaka, Bangladesh, and also a social media editor for the Journal of the Asia Pacific Society of Cardiology, that is JAPC, which is the official journal of the APSC published by Radcliffe Cardiology. So in anticipation of the APSC Congress happening this week in Singapore, I have with me a very special guest to discuss the Women's Heart Health programming. Assistant Professor Dr Ting Ting is a senior consultant cardiologist and director for Women's Heart Health Program at the NUHCS Singapore. She's also the track lead for the Women's Heart Health at this APSC meeting. Welcome, Dr. Low.
Thank you for having me.
So tell us, Dr. Low, what is the inspiration behind designing these sessions on women's heart disease at this meeting?
Sex differences in cardiovascular disease is now being increasingly being understood with sex-specific data in all forms of cardiovascular disease, from coronary disease to heart failure, phenotypes, and there are biological, sex, and gender disparities when it comes to management and diagnosis as well. And we find that it's really important that we dedicate a session or two to discuss considerations and nuances when it comes to heart disease in women versus men.
So tell us a little bit more about the must-attend sessions on women's heart health that's happening this weekend at the APSC.
The sessions are really exciting. We have coverage on conditions that have a predilection for women, such as spontaneous coronary artery dissections. And we will have someone speak on a percutaneous coronary intervention in pregnancy as well, and cardiac rehabilitation for special conditions in women. And we already know that female participants for cardiac rehabilitation is woefully low. And come on to also hear you who will be speaking on differences in imaging and diagnostic utilities for coronary artery disease as well. So that's for the morning, where we discuss female phenotype coronary artery disease under the Women's Heart Health track. And in the afternoon, there will be a special session on pregnancy and heart disease. And these are topics which we were not taught in medical school as part of medical curriculum, and now we really have to put it as a necessary educational series so that everybody gets increasingly aware of the nuances when it comes to treating pregnancy and cardiovascular disease. So we'll be talking about peripartum cardiomyopathy, coronary conditions, as well as aortopathies, which we don't often cover in pregnancy, as well as valvular heart disease in pregnancy. Very exciting sessions ahead.
Thank you very much for this detailed overview of the programming at the Women's Heart Health sessions at the APSC in Singapore, Dr. Low. I look forward to the discussions coming out of it, and I hope to see you all on the 14th of July at these sessions at APSC Singapore.
See you there.